Thank you for joining us. Good morning. This is Trinh Nguyen. I'm the Director of the Office of Workforce Development. Thank you for joining us in our series of virtual panels. This morning, we have a great panel to talk and provide input on worker safety and worker considerations as we reopen the economy. Justin Polk is our moderator today. He's the Assistant Deputy Director of Workforce Policy at the Mayor's Office of Workforce Development at the City of Boston. Justin handles the administration and enforcement of the city's living wage ordinance, Mayor Walsh's executive order on wage theft, and other labor and wage policies for the city. A 2012 graduate Boston University School of Law and a registered attorney with the Board of Bar Overseers of the Commonwealth of Massachusetts, Justin uses his legal training to advance OWDs and the city's guiding mission of ensuring access to good quality job that includes living wage and benefits for Boston residents. This morning, you'll hear from Justin and our panelists on workers' safety, worker consideration, and all other aspects of health risks and exposures for low wage and workers in the city of Boston. I'm going to hand it over to Justin this morning.
Good morning, everyone, and thank you for joining us. My name is Justin Polk, and as Trinh said, I am the Assistant Deputy Director for Workforce Policy here at the City of Boston. Just want to go over a couple of housekeeping items before we begin. If you have any questions at any time during the presentation, you can look at your questions tab in the GoToWebinar platform and ask those directly to me, and I will send them along to our panelists. If you have any technical issues, you can chat me directly, and we will try to help resolve them. We want to remind everyone that this meeting is being recorded. We're going to try to keep this to an hour and promptly end at noon. With that being said, I'd like to introduce our panelists. Let's see. First, we have, I'm sorry, 1 second. There you go. So we are joined today by Jodi Sugarman-Brozan, who is MassCOSH's Executive Director. She brings more than 25 years of experience working with environmental and social justice in Boston. As Executive Director of MassCOSH, she oversees all aspects of their work to ensure that all workers can go to work, earn a fair wage, and be treated with respect and dignity, and go home to their families alive and well. Meryum is an Assistant Attorney General in the Fair Labor Division of the Massachusetts Attorney General's Office. Her primary work includes enforcement of laws that enhance the economic security of vulnerable workers, including minimum wage, timely payment of wages, overtime, and child labor laws. Having spent most of her career in public service, Meryum is dedicated to community engagement and advocacy. Meryum is a 2011 graduate of Suffolk University Law School and a 2008 graduate of Syracuse University. Matthew Resseger is the Senior Economist in the Research Division of the Boston Planning and Development Agency, a role he has held since 2014. His work at the city includes researching and writing about Boston's economy, focusing particularly on labor and housing markets. Prior to joining the BPDA, Matthew earned his PhD in economics from Harvard University, where his research explored urban growth in highly educated regions and the impact of local zoning and regulations on racial segregation in Eastern Massachusetts. We're also joined by Shawn Clarke. He is a Dorchester resident and a worker at Sky Chefs in East Boston. Sky Chef workers cook and deliver meals on planes at Boston Logan International Airport. Shawn will offer us his perspective on what work on the front lines of the economy actually looks like. And lastly, we're joined by Darlene Lombos. Darlene is the Executive Secretary Treasurer of the Greater Boston Labor Council. Darlene also serves as Chair of the Living Wage Advisory Committee for the City of Boston. Prior to her Executive Secretary Treasurership of the GBLC, Darlene served as Executive Director for Community Labor United. Darlene has built her career on fighting for fair wage and healthy workplaces for Boston residents, and we are happy to have her here. Welcome, panelists. So first, we're going to start off with a presentation from Matthew Resseger. He's going to give us a kind of high-level view of what the economics looks like with the reopening.
Great. Well, thank you, Trinh and Justin. So my goal here is to be brief to be able to move on to other highly esteemed presenters, but to sort of just offer a little bit of data to frame the conversation. As an economist, people often expect me to start with the jobs data, but in these times of COVID-19, this kind of remains the most important slide. The slide of case count. So these are 7-day moving averages. This is for the statewide data, but really seeing where we've been, where we are now, and some sort of caution about the recent weeks that it has pushed the governor towards sort of starting to caution us, limiting gathering size from 100 to 50. We've seen case counts fall dramatically from their peaks in mid-April, but still COVID is very much with us. And as we look over the last 2 to 3 weeks, we see that the lows that we achieved in mid-June through late July, that we see some evidence of ticking up here. And so in framing, thinking about the labor market in the context of COVID-19, this data very much determines what possibilities there are for reopening. And so next slide. And so, I mean, as we've seen reopening move through phases 1, 2, and into phase 3, in Massachusetts and in Boston, this data shows continued claims. So those who filed for unemployment the week before testify to being out of work the week before, that we've seen that peak but not really decline. So for Boston residents, we're near peak levels of continued unemployment claimants, even as we're moving through into phase 3 of recovery. Next slide. And so, of course, the burden of unemployment has not fallen equally across Boston sectors. And accommodation and food services, our hospitality sector, which will be a big focus today, far and away leading unemployment claims with over 15,000 continued claims in the most recent week, for which Boston data is available in mid-July. And so again, we see that with the exception of the construction industry, which has seen claims fall quite a bit, most industries are moving slowly in reopening. This isn't to say that workers are not returning to work. Many workers are returning to work, but as those workers return to work, other jobs are lost. Others are moving towards unemployment. And so, at this point, what we're seeing is a recovery that at this point, Boston's unemployment rate at 18.9%, Massachusetts leading the state. We're seeing, what some might see as a cautious recovery, though some of the folks speaking after me will testify to some to a lot of the challenges that have been brought up, even as we haven't seen as many folks return to work as other places. Next slide. And so, in thinking about, the sectors that have the most challenge, have had the most challenges in high unemployment and bringing workers back to work, I mean, it's really about, physical proximity to both coworkers and customers. And so when we look at ONET data, which is occupational data, sort of mapped to these industry classes using data on what industries, what occupations workers in each industry work in. I mean, we see that accommodation and food services, again, our hospitality, far away, not shocking that we find, close to 80% of workers work so within sort of elbow reach of either coworkers or customers on a daily basis. And the other sectors that you see, healthcare and social assistance, retail, trade, arts and recreation, entertainment and recreation, also part of our hospitality sector, and construction, these are the jobs that have had the most trouble adapting to the COVID world. Moving next slide, and actually just skip to the following slide. So here we still have proximity along the horizontal axis, but along the vertical axis, I mean, these are also the people who were asking to take care of their coworkers and their customers the most. They have high responsibility for the health and safety of others while on the job. Of course, healthcare and social assistance, up there in terms of that metric, but also construction, folks on construction sites having to be mindful of the health of their coworkers, and accommodation and food service, retail, trade, and arts, entertainment and recreation, and public services as well. Standing out on this dimension that these are workers we're relying on to keep us and their coworkers safe as well. So next slide. And the following slide. And so, getting into sort of in the specifically in the hospitality industry, we see, some of the, proximity, throughout, any of the sort of serving and frontline jobs as being, all of these workers are confronting, in a typical day, high proximity to both coworkers and customers. Moving 2 slides forward. And so, when we look at these occupations, again, these occupations, managers of food service workers, waiters and waitresses, chefs, bartenders, as well as registered nurses, nursing assistants, personal care aide, hospitality, healthcare, retail salespeople. Again, here we're plotting proximity along the x-axis, and again, frequency of dealing with external customers along the vertical axis. I mean, these are, again, the places where we're seeing the most focus. And I'm looking forward, I look forward to hearing from our panelists, about some of the ways that these industries are dealing on the front lines with these issues. So with that, I'll cede the floor to Meryum, and thank you for your time.
Hey, everyone. Oh, Justin, were you going to say something? I think you're muted.
Yeah, I just wanted to ask Matt a follow-up question, if I could. Matt, so in looking at your graph, we're seeing that arc of kind of flattening the curve as it relates to the number of the 7-day moving average of cases. What is it about Massachusetts economy that those unemployment numbers just have not come down, even though we've been really successful in kind of tamping down the virus locally?
Mm-hmm. I mean, I think some of that is the caution that came from being a place that had high COVID counts early, that we saw, we saw the face of this in a way that some of the places that are moving quickly in reopening now are only beginning to see the true sort of face of the virus in terms of how the profound health effects on the lives of folks in our communities. So I think that probably left a little bit of caution, particularly in terms of customers. So, I think when you look at survey data on whether people are comfortable going out to restaurants, whether people are comfortable engaging in various face-to-face sort of commercial, retail stores, I think that's part of what's slowing is that Massachusetts customers are a little bit more cautious than other places. And so, as we'll discuss today, that's not entirely a bad thing. In a lot of ways, that's a very good thing. Whether, it obviously has large economic impacts, but the health impacts really, shape, this whole question. If we're not able to control this at a public health level, we won't have a successful reopening anyway. And so that caution is I think well placed, but does keep unemployment high, at least as far as the most recent numbers we see.
Great, thank you. So next we're going to hear from Meryum Khan from the AG's office, who's going to give us an update about what the AG has been doing during the pandemic. Meryum?
Yeah, thanks, Justin. Hi, everybody. So like Justin mentioned, I work in the AG's office in the Fair Labor Division. In the pre-pandemic world, generally what we do and did in the Fair Labor Division was, we did enforcement to protect economic security of workers, right? So that includes working on issues of wage theft and some of the other areas that Justin mentioned as well. Wage theft, of course, occurs across industries, and so we do cases across any industry that you could think of. So when the pandemic hit, I think that one of the big things that happened is that there were a lot of issues that already existed in the workplace that really became exacerbated and have come to the forefront of a lot of the discussions that we are having. A lot of people found themselves immediately out of work, which came with a whole separate set of issues. And now, with people sort of returning to the workplace and trying to return to the workplace in a safe way, it's sort of shifted again. So in the beginning, when everybody when the state went into lockdown, we, on our Fair Labor Division's hotline, we had a huge increase in the volume of calls. from people who are out of work, having trouble with unemployment. Obviously, unemployment is not an office that we have any jurisdiction over, but nonetheless, we got a lot of calls from people about unemployment. We got calls from workers who were still working, people working in healthcare, people working in grocery stores, people who were still in the active workforce, working out at their workplaces, not working at home. So those were sort of the questions we got at the beginning. What do I do? Do I go to work? Is it safe? What should I be doing? I don't have PPE. And I think it's important to note that the AG's office doesn't have specific jurisdiction over a lot of worker safety issues. So I think that one of the things that happened is that there's sort of been an exposure of a lot of gaps that existed in the employment relationships. And so from our end, one of the things that we've been trying to do is fill some of those gaps where we can. So since March, we have, like I said, we've been taking on a lot more calls from workers, just giving them some information about, what protections already exist in the law, that they're still entitled to all their wages, they're still entitled to overtime, all those things are still in play. Obviously, there was an impact across the workforce for people who were not working and attempting to collect unemployment. Again, we fielded a lot of those calls, but the truth was that there wasn't a lot we could do if somebody was having trouble getting through to unemployment. I think that's a whole separate issue that does need to be addressed, but for our purposes, we were just sort of, trying to talk people through it, letting them know what their options were. So now, with people slowly re-entering the workforce, one of the biggest things that has been on people's minds is, am I going to be safe going back to work? Again, like I mentioned before, I think the pandemic has exposed a lot of gaps that existed in the employment relationships, gaps that already existed in terms of worker safety, even before COVID hit. So one of the main things that we've been doing is trying to sort of serve as a gap filler. We've been taking a lot of complaints from workers about worker safety issues that they're seeing in their workplace, either with employers not enforcing social distancing, not requiring masks, people being forced to work in situations that they feel are unsafe, people being forced to work if they either have symptoms of COVID, they have somebody at home who's sick, they think they may have been exposed. Like, these are all sort of the real issues that people are seeing as they're heading back to work. So we have a complaint form on our website. We've been getting tons and tons of complaints. There's days that we've gotten, over 150, 160 complaints from workers. Now we've started getting them from constituents as well, saying, I went to such and such place and I noticed that the workers were not wearing masks, or they were working close together, or things like that. So we've been trying to basically gather this data. We try to call back every single person who files a complaint just to let them know we got the complaint, letting them know, what resources are available, whether it's a local board of health, whether it's OSHA, although, I have feelings on what OSHA is and is not doing and should be doing. I see Jodi laughing because I know she agrees with me. So, I think that there's, whether it's OSHA, the DPH, and whatever other agencies are available to do more of the enforcement. I think that because local boards of health have now been tasked with a lot more, most of the governor's reopening orders give enforcement authority to the local boards of health. A lot of them are understaffed. They don't have the resources to respond to every single complaint. And so we've sort of been working with them to let them know, what issues we're seeing. We send over referrals to them every single day, depending on the towns where we're getting complaints. We, just explaining to them, this is the situation, this is how many complaints we've gotten. It might be something you want to take a look at or do an investigation of. So I think that the AG's office has tried to, like I said, sort of fill this gap that existed. I think a lot of what we've done will end up being most helpful in terms of the data gathering. I think that, we've been keeping track of the different industries we've been getting complaints from, types of complaints, different issues that are going on. And my hope is that will be valuable information as we move forward and more people are returning to work. But, like I said,
Oh, I think we might have lost Meryum. Okay, so we'll give her time to come back. So next, I think we'll start with Jodi. Are you ready to present?
Oh, did I get disconnected?
Yeah,
Did you
Meryum is back.
Oh, Meryum's back.
I'm so sorry. Can you guys hear me now?
Yes.
Okay, cool. And the last thing that I just want to say is that while we've been doing all of that sort of health and safety types, also been doing our traditional wage and hour cases. You know, as you can imagine, there were tons of workers who were furloughed, laid off, terminated, whatever in March, and many of them either didn't receive their last paychecks, got them late, have no idea where their money is. So we have definitely been doing, you know, our traditional wage and hour work. We've tried to increase the sort of informal advocacy that we're doing. We do a lot of what we call informal resolutions, where if it's, you know, one worker, one paycheck, one time, we try to see if we can resolve it with the employer and just get the person paid the wages that they're owed. We've seen an uptick in those types of complaints as well as a result of the pandemic. So hope that's helpful. That's sort of a general overview of what we've been doing in fair labor.
Great. And so what you're saying is that you've seen, I know that previously when AG has done their kind of fair labor enforcement and wage and hour enforcement, if you see a kind of child labor violation, you'll probably also see a minimum wage violation as well. So are you seeing that connection between fair labor violations and health and safety violations as well? As people come in and have wage complaints, are they also reporting that, you know, hey, there's no social distancing at my workplace as well, or my employer is not providing masks or other things?
You know, I think it depends. I think some of it is, you know, employers are trying to adjust to sort of what the workplace looks like now as well. So we do get some complaints initially that, you know, we don't have anything, there's no cleaning, and then the employer does sort of remedy it. So we see that. But, you know, to your point, of course, there's employers, you know, there are bad employers that exist, right? So it is something we take a look at, that, you know, if somebody has a wage complaint, there are chances that other employees have that complaint. There's a chance that there's other things going on. So to the extent that when we open up a case, we try to get all the information that we can and investigate all the different avenues, we do that. But you know, I think you're right that if it's a situation where, you know, none of the workers are getting paid, presumably there's other issues going on there as well.
Thank you. And just one last question, I think this is going to be most helpful to our audience. What information, you know, in making these complaints with the AG, what information is most helpful when you're compiling this information?
Yeah, so, you know, like I said, most of what we've been doing is taking the complaints in, talking with the workers, and then making referrals out to the agencies that are doing enforcement. So just to the extent that people can provide sort of as specific information as they can, you know, we get, and like I said, we do try to call back every single worker who files a complaint to sort of get the full picture. But, you know, when you're writing the complaint, just try to put in, we get some complaints that just say, you know, there's no cleaning. So if you can include, you know, there's no cleaning of the places where the workers are working, or the bathrooms, or the place where the customers are coming in, you know, just to give us as much detail as we can for us to then reach out to you, fill in the blanks, and then make the appropriate referrals out to the agencies. A lot of times we literally just send our notes from our calls out to the agencies and say, this is everything that I know about this employer. So the more information we have, the better.
Excellent. Thank you so much. Now we're going to hear from Jodi Sugarman-Brozan of MassCOSH, and she has a presentation for us.
Great. Thanks so much for having me. So thank you, Meryum and Matthew, and everybody's here. I mean, this is worker health and safety in a time of COVID has been such an important topic, and, you know, really we're at crisis level. So this presentation just goes over some basic information on health and safety and how to stay safe, but also on what we're seeing from the data and some of our policy, what MassCOSH is seeing is some real policy needs and changes to support workers. So next slide. Quickly, we already went through this. I just throw this slide in for every presentation to remind people we are still in a pandemic, and that it's really important for people to keep this in mind. I think we're seeing a lot of folks loosen up a little bit, and we really want to make sure that people realize, especially for the sake of workers who are out there in these open businesses, that we are reminding folks that we are in a pandemic. And that's gonna, there's just a next slide. Major symptoms, you all know these, I won't go into them too much, but I think the other thing that we want to point out is that for workers who are being exposed to this through work, that it may not be just a 1-2 week recovery, that there are longer term effects, and that we need to be planning for those who have been sickened by COVID-19 as a result of workplace exposure to get the benefits that they need. Next slide. This is a really important piece and a really important slide, because there are 3 ways that people can be exposed to COVID-19, SARS-CoV-2, the virus that causes COVID-19. And I bring this up because it's a really important piece in terms of worker health and safety. We all know about the large droplets. We all know about the touching of objects and the large droplets from sneeze or cough. That's what our masks are, the fabric masks are protecting us. But increasingly, we understand that aerosol is really, and the tiny particles, airborne transmission is one of the major ways in which workers and everybody is exposed. This is a major issue for thinking about going back to school, and this is a major issue for workers. Unfortunately, most of the standards that the state has created are focused on 1 and 3 and very little on 2, and protecting workers from those airborne aerosol transmission. And that is really something that we have been focusing a lot on. Next slide. And this is just how do you get infected? The amount of that you're exposed to times the time exposed tells you the infection dose. And this is another important piece in thinking about how to protect workers. When you think about what needs to be in place, that's how the necessary conditions for infection. Next slide. And the hierarchy controls is the tool that most people use in thinking about how to create worker health and safety protections. And this is one that we put together just for schools as an example. And you want to always have the most effective in place before you move to the least effective. And there's a lot of conversations about PPE and the importance of PPE, 100%. But really what we want to do is look at all the various ways that the hierarchy of controls can be put into place. So in a school, obviously, or the way we look at this is first, physically remove the hazard. That's not going to happen until we have a vaccine. Replacing the hazard, that's staying home, staying in place, remote learning. Engineering controls are some of the different plastic barriers, the ways that we think about setting up the workplace. Administrative controls are changing the number of people in a room, changing the way that a job is done. If you're talking about a meat packing facility, rather than right next to each other, maybe every other person. And these are ways of creating some of the distance, but may lead to slowing down in productivity. But again, this is this hierarchy of controls is the tool that the National Institute of Occupational Safety and Health has created, and one that's a really important way of looking at how to protect workers. Next slide. Oh, and these are, it has a special, these are the, I forgot about the animations. Remote learning. Then this is the slide we set up specifically in thinking about schools. This is a really important one that has been talked a lot about in Massachusetts, and that the impact of COVID-19 has been very unequal. And we know that it has affected people of color more than their white counterparts. And Hispanic residents make up 12% of the population, but are nearly 30% of the positive cases in Massachusetts. Black residents are 7%, and of the population, but their rate of positive COVID-19 cases is nearly double that. And overall, the state data shows that the rate of positive cases among Black and Brown residents is more than 3 times that of white residents. And we believe that work is playing a significant role in that. Next slide. We know that many of those frontline workers are disproportionately people of color. And this is just a slide showing the total amount of Hispanic workers, the total amount of Black workers, and how it relates to the proportion of different frontline and different industries where we know are being very much affected by COVID-19. So when we look at the unequal impact for MassCOSH, we think it's really important to remember that there are many factors that contribute to that, none the least of is work. Next slide. And at the same time, the agency that is supposed to be protecting us is just missing in action. And Meryum, you alluded to that, but the Occupational Health and Safety Administration has really done absolutely nothing, literally, to protect workers at a time when we are in one of the worst worker health and safety crises in decades. There have been 9,986 COVID-related complaints in the country right now, and that was a couple of days ago. It's probably gone up, with maybe at most one citation which was reporting related. So just to give you the sense of how little is happening despite all of these, despite all the complaints going into OSHA. In our region, there are 30 open COVID-related workplace fatality investigations, and that's a huge number. Generally, in a whole year, there are maybe between 50 and 70 workers who die as a result of workplace injury or exposure. So having in just 5 months 30 open investigations is not insignificant at all. And it's important to point out that these are healthcare workers and workers in long-term care facilities, but a good fifth of them are workers in retail and grocery store workers. These are not typically jobs that are considered dangerous, yet people are literally dying on the job as a result of their exposure on the workplace. And, you know, just to talk a little bit more, I think that for OSHA, I don't know how else to say it, but I think they're really going to have blood on their hands at the end of this pandemic. At least 35 healthcare workers have died after submitting complaints before there were even investigations. It's really, really devastating. So what does that mean? It's basically pass the buck to the states, right? And if you could go to the next slide. In Massachusetts, the governor, as part of his reopening, convened a reopening advisory board that on it was really missing any representation from workers or occupational health and safety experts. And the results of that were a set of workplace health and safety standards and a reopening plan that, when it began on May 18th, MassCOSH and other partners gave failing grades. And we gave it failing grades largely because while they were standards, they were not enforceable. The screening and testing and surveillance of workplace exposure was missing, and there was very little to protect workers on the job and protect their voices, protection from retaliation, and protection from loss of employment due to falling sick, all of those kinds of things. Next slide. This is what the standards have. They're basically focused on the 4 social distancing, hygiene, staffing and operations, and cleaning and disinfection. All businesses must self-certify that they meet these standards. So it really, there's very little inspection involved, and there's very little oversight and real enforcement. Enforcement is being left mostly to local boards of health. And what that means is that our local boards of health are really on the front lines. They are it. They're what's standing between workers and unsafe conditions. We really are thankful to the Attorney General's office for the work they're doing to accept complaints, because when the reopening plan was first relaunched, there was no place for workers to call to report unsafe conditions, despite all of these different standards. And I do want to point out that the Department of Labor Standards has now promulgated emergency regulations based on these workplace standards. So there's a hearing on September 9th that will give us an opportunity to maybe strengthen some of these. But again, it depends on self-certification, and it depends on, you know, really relying on overworked, understaffed, and low capacity local boards of health. Next slide. I'll try to go really fast, I'm sorry. So how do you get help? This is the, you know, who you call, your local board of health, your Department of Labor Standards, or if you issue a complaint through the Mass Attorney General's office on their online form. It's been incredibly helpful because we know that they are calling and getting these to the right people. I also want to point out that it's really the level of enforcement or the consequences of not following these regulations is maybe a $300 fine. It's pretty minimal, and you have to be contacted up to 5 times before you can get a cease and desist letter. Though I think some local boards of health are moving more quickly on this despite these regulations. That means that 5 times, think about how many people are being exposed before they get an employer gets a $300 fine or a cease and desist letter. Next slide. So thank you, Meryum, because you also are sharing all of your data online. So we pulled off of all the complaints by industry and have done some analysis. You can see those that are most affected. Again, I think it's important to point out that, as Meryum mentioned, these complaints are coming not only from workers, but also from members of the public. From our perspective, that's good. Unsafe work conditions, fear of retaliation often prevents workers from making these complaints. So when we have the added benefit of some of the public being able to make these complaints, but you can see restaurant, hotel, retail sales, it really matches, Matthew, with what you presented in terms of close proximity. This is where we're seeing the most complaints by industry. Next slide. And the complaints are on the rise. This is the other thing. This is week by week. Again, we're seeing that every week the Attorney General's office is getting more and more, up to 100 times a day. Next slide. So what do we want? Stronger enforceable health and safety protections, more resources and support for local boards of health, protection of workers' voices, and more tracing and occupational surveillance. Right now, we don't even know the impact that the virus has had on workers because the state has failed to get any information on the occupation and employers of those who tested positive. And I'll go quickly through the last slides because what does this look like in terms of a policy agenda is we're working really hard for occupational presumption. That means that if you are a frontline worker and you got sick with COVID-19 because of exposure at work, it should be presumed that you got it at work and you get those benefits. We know this is a problem. As of May 31st, the Department of Industrial Accidents had received 2,915 claims from workers who lost more than 5 days of job as a result of COVID-19. Only about 20% have been paid. Next slide. Data and surveillance. Again, the occupation and employer of workers has been missing, of COVID patients has been missing. So we have no way to identify which workers are most affected. We have no way to identify workplace outbreaks. We have no way to identify which occupations have been the hardest hit. And this is really something we need to fix. A new data law did in fact require occupation be collected, but the online data that's been collected, because because there's no real way to do that and folks have not been trained on it, it's missing in 80% of the data that the state has posted. Next slide. Additional compensation for dangerous work. We've all heard it, hazard pay. Next slide. As much paid sick time as people need. And there's a paid sick time law that is making its way through the legislature, which is really critical. Next slide. Additional protections for low wage and immigrant workers has been something we've been working very hard on. Next slide. And we have a number of tools, multilingual toolkit on our website. We have done, I just counted in the 5 months since we've been on board, since this has been happening, we've trained over 2,000 workers. We've held town halls with over 2,200 people attending. We have a health and safety network of experts that we have mobilized and are now working very hard with MTA and AFT around on return to work and our Worker Center hotline. I think I'll end there because I've definitely taken up plenty of time. Thank you. And those are just some of the pictures from. Thanks.
Thank you, Jodi. I do have a follow-up question, and this is something that's kind of been bothering me, and I've been seeing it in the news, and it kind of unites your presentation with Matthew's when we're talking about exposure in these kind of forward-facing roles and dealing with angry clients and customers. We've seen in the news, especially I think the latest case was in Bethlehem, Pennsylvania, where workers have been left alone to kind of enforce their local and state mandates regarding masks. Have you seen anything in Massachusetts in your research that would suggest that something like that could happen here, or what should workers do if they're faced in that situation where they're in charge of enforcing their store or whatever's mandate?
So we have seen totally increases in that. And in fact, we have a lot of requests for workplace violence and de-escalation training, which we have a lot of expertise on, particularly for young workers who are at the front lines. It definitely is a need here in Massachusetts. I do know that the state has just launched a new enforcement arm, which is focused specifically on some of the more public-facing masks, size of gatherings and things like that. I don't know enough about it, but it sounds like, helping to refer people to that. But I also, employers should be stepping in to provide support and guidance and training to workers, and also be really clear about the expectations about masks and health and safety regulations so that it's not left to workers. I mean, if there's a theme of this pandemic, it's that workers have been left to fend for themselves over and over again. Organizing is the only way people are getting protections, because the health and safety protections and the regulators that are supposed to be there to protect them are non-existent. So employers stepping up to do their job to help support that seems really critical, because workers have really been left to fend for themselves.
Great, thank you, thank you. So next I want to ask our guest, Shawn Clarke, some questions. Shawn, you work at that interesting nexus between hospitality and tourism as a member of the Sky Chefs team. Can you kind of give us a sense of like what your work has been like, what protections that you've seen added, kind of things that you want to see that are not present in your workplace? Uh-oh, I think we have Shawn on mute. Let me just.
Shawn, you can unmute yourself.
I think Shawn is now unmuted. We still can't hear. Oh, let me just try this again. We cannot get him unmuted.
Shawn, is there a button on your right-hand side of the webinar panel, and it should have a microphone? If you click on that microphone, it should unmute you. Okay, have you tried that?
It's saying that he's unmuted in the, still no volume. All right, so we'll try to do some tech with Shawn, and then we'll come back to him. For now, I'll go to Darlene. Darlene, you've been working with AFL-CIO on some interesting things for workers. You mentioned a worker safety guide. I wonder if you can talk about what's coming out and what workers can expect to see.
Yeah, thanks for inviting me. Thank you, Trin and Justin, for being part of this panel. It's been such great information. Jodi's amazing, Matt and Meryum, the AG's office is awesome. I've been really working with all of us to try to get a handle on this, both pandemic, but also the racial justice uprisings that have really been incredible inspiration to all of us, but also have, as Meryum said, really exemplified the gaps that existed before COVID. And it's fitting that I'm following Jodi, and because really unions actually matter a lot. There's a big difference between workers right now who have a union and who don't. And that's a real important thing to point out. This was clear even before COVID, that worker protections with unions, worker safety protections with a union was much in contrast to those without a union. But just to give some examples, the 10% increase hazard pay that Stop and Shop workers got from Stop and Shop were not necessarily out of the goodness of the hearts of many employers, but certainly the organizing and the collective bargaining agreement that the UFCW 1445 have. That relationship is really key in a time period like this, in these unprecedented times. And then there are laid off workers who have no protections at all, have not been able to get access. They are in bread lines. In fact, some of the worker centers that Jodi and I work with have opened up food pantries for many of the laid off workers. So it is really telling. We have 100% unemployment in the live events industry. This IATSE is one of our affiliate unions, and they've been incredible at volunteering their time to deliver food and pack food boxes and make face shields, but they also were able to negotiate with their employers in the union, the ones that are unionized, for health insurance for this entire time period. So again, these are not things that non-union workers are getting, and in fact, as Jodi said, it is only through organizing that workers are actually getting what they need during this time period. I did want to share, so we did put out initially when the pandemic hit, when things were shut down, just a resource guide for all of our union members. Just talked about where you might be able to find services, mortgage and rent relief, utility stuff, just things that people who would not normally find themselves unemployed would not have access to. So we put together a resource guide. And then we helped support unions in putting together their own recovery plans, worked with the state AFL-CIO and other unions to have people start thinking about that. And then now also as people are reopening as employers in these different phases, we've worked with MassCOSH, State AFL-CIO, Siegel-Reutemann, Massachusetts Employment Rights Coalition, Greater Boston Legal Services to put together, for lack of a better term, a workers' rights manual. It is really just a summary of some of the labor laws and protections that people do have if they do not have a union, as any worker will have. There's some general ones. And I'll just point out a couple. We hope to have this manual out in the next week or so. But for one, there's the Federal Families First Corona Response Act. That's really important. It expires at the end of this year, so hopefully there will be some sort of extension. But it does give 80 hours, 10 days of paid sick, emergency paid sick, and also 12 weeks of childcare, 10 paid and 2 unpaid. So that's a really important protection, worker protection, to make sure that people know about. Another one is the Family and Medical Leave Act. People might be already familiar with that, but that's for employers that have 50 plus employees and they're eligible for 12 weeks unpaid leave. It is unpaid, but it is at least at least you're not terminated and you are able to use that leave, and also your health insurance will be able to stay intact during that time period. There are some eligibility requirements. You have had to have worked at least 1,200 hours before the 12-month period, or 12 months before that leave. But that is an important law that people have to protect themselves during this time. And then obviously there's unemployment insurance, and there's a lot of issues with unemployment right now. There is a need for an extension of the $600 supplemental that the federal government needs to really act on. But there are some important things around unemployment insurance that are coming up as people are going back to work. The questions about whether I'm on unemployment right now, if my employer calls me to go back to work, am I able to continue getting unemployment if I can't go back to work? And so there are some conditions, some important things to keep in mind around refusing to work or refusing to go back to work. There are some things to really look at in terms of qualifying whether the workplace is indeed a safe workplace. If there are unsuitable conditions, there's some good language at least that you can make a case, but certainly it's very strict as well. So there are some reasonable refusal criteria that we'll have in the manual as well. There's also the American Disabilities Act. There's a few other things that will be in there that show some protections for workers. And then we did include under the National Labor Relations Act, there is a protection for concerted activity. That just means that when people come together to try to voice their concerns in the workplace, whether you have a union or not, you are protected in doing that. And so we wanted to let people know that that's important. Jodi talked a lot about OSHA and their inept work that's happening, or lack of work that's happening right now, but there are some under OSHA, some qualifications around dangerous conditions that can be ways to think about refusal of going back to work in unsafe conditions, dangerous conditions. And then there's some whistleblower policies that are particular to public employees in the public sector. So that will all be sort of summarized, and then it will provide some links to some of that to get more detailed information. But that is some general laws that do protect workers, whether you're in a union or not. That's important to know about. And then there's certainly some with the Massachusetts AFL-CIO and MassCOSH and others. We are pushing for pieces of legislation that are about protection for workers. Jodi already talked about occupational presumption, but the two other ones are hazard pay for essential workers and emergency paid sick that still have not been acted upon by our legislature. So we're really pushing for those two things. I think that is about it. I mean, I think that there are some conversations about how elected officials on the municipal level can help negotiate and advocate for things. The mayor of Boston has certainly, coming out of the unions, has been a big voice, but it has had unions a part of some of the reopening drafts and that kind of thing. But obviously, Jodi, as you mentioned, the Baker administration has not included workers at all. But at the end of the day, there's no win-win here around reopening. I mean, it is really difficult. There's going to be some really hard choices, and whether it's education, whether it's hospitality, all these industries. The bottom line is that public safety, public health, and data really need to be driving our decisions and not profits. I mean, that's the real important message, I think, that this pandemic and racial justice uprisings have given us, is that our lives are worth more than any kind of profit and any kind of dollar amount. And so that actually needs to be at the center of any kind of policy and any kind of reopening plans. And workers at that very important, unique perspective provide that. And so it's really important for all of us to advocate for workers at every table, at every juncture here. I'll stop there.
Thank you so much, Darlene. As always, you're a great advocate. Shawn, hopefully we have you back. Let's just try your microphone again. Can you hear me? Can we hear you now, Shawn?
Yes. Can you hear me?
Yes, we can. Thank you.
All right.
Thank you so much for sticking with us. Yeah,
Okay.
I wanted to ask you about, like I said before, you're at that interesting nexus between tourism and hospitality, and both have been impacted greatly by COVID-19. Now that you're, on the job, and what are you seeing as far as working conditions? Have you seen enhanced protections? Are there things you would like to see more of? Just give us a sense.
Okay. Well, I'm not back on the job because I am totally laid off.
Ooh.
Because corporations, they got the money from the government. How I'm looking at it, they laid off who they wanted to lay off. They keep them who they need to keep. By them doing that, they're trying to save money because they're going to do more layoffs in October. And that's really going to hurt a lot of people that work in my department and throughout the whole building. On the safety issue, I'm in one of the committee members that we've been fighting, making sure everybody has sanitizer, masks, how they check in for temperatures, social distancing inside the building. We worked out a plan with the company that, okay, we don't want you laid off 100, so we have 230 people. We don't want 230 people in the building because 50 of our workers caught the virus. One lady died, and I know her very good, and she was a nice lady. She died from it due to the company not letting everybody know, okay, this is what's going on. Because at the time when the virus was kicking in, the corporate was just listening to the president instead of using common sense to say we need to keep the workers safe. No, us the workers, we had to defend. We had a meeting with people in the top office about, what are you going to do about the masks, and we're going to get sanitizer. You're going to be disinfecting the building. What are we going to do? And you get the same thing. We're going to work on it. We're working it with you. And that wasn't something I wanted to hear. I wanted to say, all right, we're going to get on it right now because you're important to us. But how I look at things now, I look at it, well, no, we're just part of the part of the machine that just makes money for somebody richer who doesn't care about whether I'm sick, whether my family's sick, your family's sick. They don't care. They just care about, like somebody said, about profit. That's all this is about. It's about money. It's not about our us as human beings, about our safety. And me being a worker and seeing that, it's just like, it's just crazy. And to know that somebody that you know that you work with for so many years has passed away because they're dying from something that could have been handled from the beginning. And just see how my job, how they just took their sweet time in doing things because, oh, they needed permission from Texas at the headquarters. Or Texas needed permission from the real headquarters in Germany, just for our safety. So right now we implement where only 50 people are at work. We have the company, they got the CARES Act money. Is that what the CARES Act? So they got some money and they waited until July, the end of July, when the $600 is over to say, okay, we're going to bring back these 200 something people, but they're going to be on payroll. We know that, okay, the unemployment's running out, but it's just like how corporations just try to drain you and to make you feel less than a human being. And that's what I used to go through. So every day you're dealing with a supervisor that doesn't care. We talk about safety things. I talk about plenty of safety issues in this building. And it just goes in one ear and out the other until we had to really fight for you to listen to me. And now it took this pandemic for them to really, they were slow at it. Now they're working on it. But from talking to other members from my union that's inside the building right now, they said it could be a little bit better, like the social distancing and, you know, just like making sure people's masks are on the face, because we get lax. Because we're so comfortable doing what we're doing in the past, we have to understand that's done. This is our new norm right now. And I feel as though the job needs to really get on people because you're going to spread the virus again. And people say, well, how did it spread through there? I said, listen, I work in the airline industry. And when it first came, it came right through Logan Airport. It came through Logan Airport. It came and passed on to the driver's helpers, and brought it back to the kitchen. And it just went from each department. Each department, somebody got sick. And the company just took its time. They didn't want to tell people that, oh, people were getting sick. I have asthma. So I used my common sense. I said, listen, I'm not going to stay up in here and die for this company that only pays me pennies while somebody sits in a big $10, $20 million house and looks at me like I'm nothing. I have to think about my family. I have to think about my health. So I decided to take a voluntary leave of absence. And we were encouraging everybody to do it because, look, money ain't going nowhere. Money is always going to keep coming, however it comes. But your life, you only get it once. You only get that one time. And to lose that in the way how this administration is just looking at life as like it's nothing, and they worry about profit, it's just crazy. And a lot of people feel the same way I feel. We just feel that Sky Chef should have did a much better job with all its employees all across the country. And I'm getting, there's some words I want to use, but I can't use it. You understand how I feel because I'm on the front lines. I've seen it. And being out, I've been helping people get with the unemployment, trying to get food stamps. People that work hard, they have to go back on stuff. Trying to get people the mass health and Medicaid. We're doing it all. Local 26 and Unite here we're doing it all for the hotel workers, for the cafeteria workers that work in these colleges, and us at the airport, and especially us at Sky Chef. I've been putting in my volunteer, my time. I'm not getting paid for this, and I'm not looking for. I'm looking to help out my next brother, my next sister. And it's been an emotional drain since March, since I've been out of work. And you know, I hear the stories about the lady being on the respirator for almost a month, and she lives in Chelsea, and that was one of the hot spots. The vast majority of the workers work in all these hot spots. So of course, it was passing on to the, it was just passing on, and on the health wise, the state, the city, we need to do more. We just need to do more. To get reopening because people need to go back to work, but at a certain point when everything was shut down, you didn't hear all these little spikes going back up. You wasn't having all this violence out in the street because people are mad. You get bunched up. You're in the house every day. You want to be away from your family. You want to be away from your next door neighbor. You go to work, and that's your mindset. And you don't have that no more, so you have to deal with this new norm. And on the safety wise, I have to wear my mask. I'm all like in the store, I see people not wearing the mask, and people want all my liberty rights. It's not about your rights, it's about surviving. And that's what I be trying to tell my workers, like, it's all about surviving. Make sure your mask is clean, your kids, everything. So it's been a very hard, almost 5 months. And now that the $600 has gone away, I have to reconfigure everything, even though I'm paying my bills and I'm taking care of my family. On my mindset, I'm all like, I got to think about the next day, the next month, this bill, that bill. I have to buy my medicine. It's just crazy. So I, as one of the workers out there and seeing people getting sick and stuff, I get mad because when you do complain to the boss, they're just like, okay, yeah, all right, we'll work on it. Stop working on it. Do something about it. And people are dying. And that's all I have to say.
Thank you, Shawn. Thank you so much for that perspective. That's real, ladies and gentlemen. That's what's happening out there. This is not graphs. This is not statistics. This is a kind of real life perspective of what the pandemic has done to workers and to families. We have about 10 minutes left, and so we want to open up for audience questions and have a conversation with the audience. So feel free to put your questions in the chat or the questions tab. While we're doing that, I did want to bring up a question with the panelists, and Jodi and I had talked about this offline. And you can speak from the perspective of an expert or as a parent, but are you concerned now that we've seen the kind of uptick happening in cases? And I think there was a study that came out, I think last week, saying that the last 2 weeks of July, 100,000 kids tested positive for COVID-19. Are we concerned now that schools are reopening about not so much children getting seriously infected, but children, our parents of school-age children becoming transmission vehicles for the virus into workplaces? It's open to anyone.
Yeah. If I can start by saying, I think because we talked about this, Justin, that, we talked about this, the concern around indoor air quality and exposure to aerosol. Indoor air quality was a problem in schools pre-COVID. We've been working on addressing issues of unhealthy school buildings for literally decades. And we at MassCOSH are very concerned about what that means for teachers. And, we talk about schools as being places of learning. Of course, I'm a parent, I'm a Boston Public Schools parent, but they're also places of work for thousands of Massachusetts residents. And the buildings at this moment, we cannot guarantee protection from those small aerosol and airborne transmission. No matter what we do for social distancing, the ventilation in some of these buildings is just not ready. And as a result, I think there's going to be spread and exposure that's going to impact teachers, impact staff at schools, students, but then ultimately contribute to the spread in the community as well.
Anyone else want to chime in? Yep, John?
You hear me?
Yeah.
Me being a parent, me and my wife, we talked about it, and we really don't want our daughter to go back to the school. Not that same thing. It's not safe for her. All these, I've been hearing about, we trying this, we're trying that. Let's do common sense. They're still going to be in a small classroom, bunched up together, and you know how kids are. They get to a point where they're going to constantly, I'm going to take my mask off. I need. That's how we are. Children are just going to be like, oh, I don't want to do this because, you know, they're hard-headed half the time. And I'm thinking about her safety. She bring it home to me. I have asthma, and that affects me, and it can affect me big time. I'm not, and if I'm out the picture, they have to struggle because I'm not there to support. I mean, I start thinking about that. I just feel that remote learning, we just got to stay on it for the safety reason until we get this thing under control. That okay, we can send the kids back to school, but right now, as a parent, I'm more concerned about her health, her well-being. I get it that you know we have to socialize, we have to be around our friends because that's as a human being, that's part of our DNA. But at the same time, we have to start like I said earlier, it's a new norm. I feel as though the remote learning right now is the best and safe way to keep all our kids, all the teachers safe. And that's the way we should go right now. I just watched it in that Georgia, the girl videotape how crowded the hallways were, and she got suspended. But she was thinking about herself like, this is not right. This is unsafe. And we can practice the social distance with our kids. We can do everything, but when you get them back in school, we don't know where they're at home. They get around there, they pull their mask down because they want to talk to their friends and this and that. I can't afford my daughter to get sick. I can't afford myself to get sick. How the bills are gonna get paid? How this is gonna get done? So I have to look at it as being a parent, like I have to do what's best for her. I get that they need their education. Yeah, this right here, she's been doing good with it. She's been there. We put her in summer courses with it. She still today. I had to wake her up right on time. As long as we implement that right now, they'll get used to it. They're used to it. It's hey, we just treat it like they're going to school. Hey, you got to get up, go get dressed. You're gonna sit there. You're not gonna be in your pajamas. You're not gonna do it in your bed. No, this is school time. We need to implement that with the parents. So like, well, we have to treat it like they're in school. They have lunch. Hey, take your break, come back, go. End of the day, it's yours. But at least I know that you're home safe. Some of our schools in Boston are so old, they don't have the adequate ventilation system. These buildings are old, like 60, 70 years old. And these kids have to be in these classes. No AC, nothing. And it's just crazy. And then when you deal with hundreds of kids a day and these teachers, I have to look out for the teachers. How can they teach if they're sick? How can they teach if they pass away? It just, as a parent, it's just like we need to think more about sending them back to school. That's my thing on it.
Thank you. My next question, we still don't have any audience questions just yet. Darlene, I was going to ask this after you finished speaking. I didn't know if we had enough time for it. What do you see as the future of organized labor? A lot of us never saw COVID-19 happening. It came out of nowhere. And so when you think about negotiating benefits for employees, and you think about some of the things that have been happening with insurance, or there's these force majeure clauses that exclude coverage, specifically in the case of pandemic that no one's ever read until this year. What do you see as the future of labor and organizing and getting from bargaining for better benefits, health benefits, workers leave and that sort of thing for workers in the coming years? Is this just a one-off, or do you think this is going to really impact organized labor?
I think absolutely not a one-off. Even before COVID, there were people working hard to work on paid sick. I mean, there are concerted efforts before Corona to increase protections for all workers, to incorporate what unions have negotiated by building collective, powerful membership-based unions that can bargain with their employers. That won't change. In fact, there is more essential workers who are not part of unions that are finding themselves in a position where they have to raise their voices about what's happening in the workplace. Whole Foods workers, other grocery store workers, retail workers. And so I don't, in terms of changing, the way the labor movement has operated, or if this is a shift, the shift is all good. The shift is knowing that every worker is essential. The shift is putting public health and safety at the center. The shift is making sure that people who are most affected by the issues, that's both community and labor, workers and leaders in the community, are at the center of policymaking. To make sure that it's data-driven, research-driven, that we're not actually, using a formula or algorithms that are increasing profits as our measure for what kind of businesses are going to reopen, or when it's time to do things in our economy. So we see this as a huge, reset, reshift, reclaiming a more just recovery, to shift the way in which we've actually looked at what the economy should be providing for all of us. And it seems kind of vague and nebulous, the economy, but we are the economy. Workers are the economy. Labor, people who are every day trying to make it work. We're the economy. So that is a major shift, I think, that is going to be to live with the labor movement and hopefully the larger social justice movement beyond this.
Thank you so much, Darlene. It looks like we are right at time. I want to thank our panelists for joining us today, and thank you to the audience for listening in as we discuss these important issues. Just a reminder that the video of this webinar will be available on our website within the next day or so at owd.boston.gov. Again, owd.boston.gov. If you have any follow-up questions that you want to ask the panelists, you can email them to me directly at justin.polk@boston.gov, or you will receive a follow-up email within a day from GoToWebinar with my email address, and you'll be able to send in your questions that way. Thank you again for everyone attending, and have a good day.
Thank you.
Thank you.
Bye.
Thanks for having us.